Hi everyone, it is Dr. Lanice and I am a speaker, blogger, social media expert, and I take care of sick babies for a living. I love to help tired, stressed out, frustrated moms who have preemies in the NICU. I like to help them better understand their baby's illness, more effectively communicate with their NICU team, and most of all know that they can make it through the NICU journey and that they do not have to do it alone. So I am back to you today on this Wednesday for another weekly Wednesday Facebook Live at 7 p.m. Eastern Standard Time, where I talk all things preemies, babies, and NICU to help give moms and dads and family, friends, and loved ones more information. So in honor of the fact that the month of July is National Cleft and Craniofacial Awareness and Prevention Month, I wanted to talk to you about 4 things you need to know about cleft lips and cleft palates. So let's get started. So the first thing that I want you to know is, well, what is a cleft lip and what is a cleft palate? So this is something that affects the structure and formation of your baby's face. And what happens is that they can have a gap or an opening in their lip that can look like a very small notch or can extend from the lip all the way to the base of the nose. When they have this, that's a cleft lip. Now, if you were to take your, that's on the outside, but if you were to take your tongue, right, and run it along the roof of your mouth on the inside, that is where the palate is. So towards the front, it feels a little bit more firm, and that's called the hard palate. And then if you were to extend your tongue all the way to the back of your throat, it feels a little bit softer, and that's what we call the soft palate. So there's 2 parts there, and both of those can be affected if your baby has a cleft palate. So it can have it in one or both of those areas. We also know that babies can either have just a cleft lip, just a cleft palate, or they can have both. So if you've never heard of this before and you have no idea what I'm talking about, it can be very hard to picture. So I'm going to try to show you this picture here now to explain what I mean. So this is a picture here of a baby giving an example of a cleft lip and the cleft palate. So you can see here, this is the example of the cleft lip. You have that separation or gap, right, in the baby's upper lip that extends here in this picture from the lip or the mouth all the way to the base of the nose. But again, it could also be just a small notch that affects the lip on either side or both sides actually. And then for the baby who has a cleft palate, so, again, the baby's head is back, so you're looking in at the roof of the mouth, and it may be a little hard to see, but there's an opening or a gap there, and this is basically where the cleft palate is. You're going to have a better picture here if you look at the bottom of what the cleft palate looks like. So that can be an example of a cleft lip or a cleft palate, okay? So that's what it is. What we do know is that in boys, more commonly, they will either have just a cleft lip or a cleft lip and a cleft palate, and we know that more commonly girls will present just having the cleft palate, but both boys and girls can have one or both defects. So this is something that occurs worldwide. We know that it can occur in every 1 in 700 babies worldwide, but here in the United States, we know that it occurs close to about 1 in 1,000 babies. So this does affect, a fair number of babies that are born, and that's why it's important to sort of bring awareness and to talk about this issue. Okay, so number 1, we have talked about what is a cleft lip and what is a cleft palate. The second thing that I want to talk to you about is, well, why does this happen? How does this occur? And what we know is during pregnancy, when the baby is developing inside of mom, inside the womb, we know that different tissues and bones are being formed. So at about 6 weeks, this is when the baby's upper gum or lips are being formed. And then by about 10 weeks, this is when the hard palate inside the mouth is finished being formed. So we know that if something goes wrong during this process, this is actually when the baby can be born with these defects. So it's also important to know actually that all babies have this gap or this separation in the upper lip and in the palate. And then what happens is, during the developmental process, as the baby's forming inside mom, these actually come together and join. So when these, the bones in the lips and the gum, the bones in the gum don't come together, or the lips don't come together to form it in the palate, this is actually what results in having this defect. So we know that there's 2 sort of main factors that can cause this in babies. We know that there is a genetic component to it, and we also know that there's what we call environmental factors involved as well. So we know that genes are involved because if a baby is born into a family where both mom and dad, either mom or dad have had a cleft lip or palate, or a sibling or another family member, they are more likely then to be born with this defect than if the baby is born in a family that doesn't have this history. Also, if a baby is born not just with a cleft lip and palate, but has other abnormalities as well, sometimes with heart defects and other things that can come together to form a syndrome, then we know they're more likely to have a cleft lip and palate as well. Environmental factors are also playing a role because we know that moms who take certain medications during pregnancy, we know this can cause the babies to have a cleft lip or palate as well. More commonly, we talk about certain anti-seizure medications that can cause this. So when you go in and you're meeting with your OB doctor, if you have a history of seizures, then they're going to talk with this about you and talk about what to do and what medications will be safe or not safe to take during pregnancy. Other things that we know is when moms don't take enough folic acid, right? We know that if they're not getting enough of this supplementation, then again, your baby is more likely to have a cleft lip or a cleft palate. In fact, people say that, folic acid is so important that moms who are thinking about getting pregnant, you should even start taking that up to a year before you want to do this as well, just because we know this is so important to prevent birth defects in babies. We also know that, again, we do not recommend smoking or taking drugs or drinking alcohol during pregnancy because we know that moms who do this have a higher risk of having babies with birth defects. And again, a cleft lip or a cleft palate is one of the most common birth defects that a baby can have. So we know that all of these things are factors that can affect a baby's chance of having this issue. Okay, so number one, we talked about what is the cleft lip and what is a cleft palate. And number two, how does this affect your baby? How does your baby get this? We know that genetics can be involved, and we know that environmental factors can be involved as well. So the third thing is, more specifically, how does this affect your baby? So obviously, one of the main things that you can think about is eating, right? Because it affects the baby's upper lip and can affect the jaw as well as the palate. So you know that a baby sucks, right? They suck whether they're at the breast or whether it's the nipple on the bottle when they're getting milk or formula. So we know that it's hard for the babies to sort of generate enough pressure that they need to suck and get that milk or formula when they have this opening or this gap in the lip or in the palate. So that is definitely one way they can affect babies. And in those babies who have a cleft palate, when they take in the milk or formula, it can go in through the mouth and actually come back out through the nose, right? So if you remember the picture, that defect can extend right from the lip all the way to the base of the nose sometimes. And then if they have a big defect in the palate, again, this can be more likely to have issues or difficulty with feeding. We do know that if a baby just has a cleft lip, they tend to have less issues feeding, but they can also have this issue as well. Again, breastfeeding again can be another issue as well, depending on how big the defect will be. Another way in which the baby can be affected is their hearing. That doesn't seem obvious, but the reason why is one of the structures that is actually part of the ear is called the eustachian tube. And what it does is it connects the middle ear to the base of the throat. And so as a result of this baby having the defect, they're more likely to get fluid to build up in that middle ear. And what this does is make the baby more likely to have ear infections that can lead to scarring. And so this can actually affect the baby's hearing. And then one of the risks of that is hearing loss. So this is another way in which the baby can be affected. So when the baby has this opening in the lip, it can also again affect the jaw, so it can affect the gum. So if they have an opening there as well, it can affect how the teeth develop and how the teeth come in. And sometimes they can have extra teeth there as well. So we know that it actually affects your baby's sort of oral health and hygiene and how their teeth develop and come in as well. And then another way that this can affect your baby is similarly to how, again, because they have this gap or opening, they have difficulty kind of with sucking and generating enough pressure. It can also affect their speech as they're growing and they're learning to make sounds and they're learning to talk. This can also affect sort of the sound quality of their voice and sort of how they pronounce things. So we know that is another way that your baby can be affected as well. Okay, so again, we've talked about what is a cleft lip and palate, how or why does this happen, and how does it affect your baby. So the good news is, number 4, we're going to talk about treatment. There are absolutely ways to treat this. So you can imagine that, one of the main ways in which it's going to be treated is surgery. So if your baby has the cleft lip, typically that's going to be repaired at about 3 to 6 months of life. And then if they have a cleft palate, that tends to be repaired around 12 to 18 months. So this is going to depend on where you are, where you're delivered, what hospital and what surgeons are involved. But they're basically going to meet with you as a family, and based on your baby's specific defects, they're going to talk with you about when will be the best time to repair it. So one of the things to remember for your baby who has a cleft lip and palate, it's going to involve what we call a multidisciplinary team, which basically means that we're going to have doctors and specialists from all different specialties coming together to take care of your baby. So it's typically going to involve a plastic surgeon, ear, nose, and throat doctor, an oral surgeon, hearing specialist, also known as an audiologist, is going to be involved, as well as speech therapists. And then later on, as your baby continues to get older and grow and develop, it might also involve a psychologist or a therapist as well, because they have to deal with sort of social issues of learning how to interact with other kids and making sure that their self-confidence and development is okay as they're handling, having a very obvious sort of cosmetic defect and learning to interact with other children. So what do we do about the feeding issues that the baby has? Well, we have special bottles with special nipples to help the baby to eat, to decrease that chance or that risk of the milk and formula coming back through the nose. So that's specially designed for those babies. Some babies will not be able to breastfeed, but for those who can, they can work very closely with the lactation specialist who can go over certain positioning and different things to do to make it a little bit more easier for moms to breastfeed a baby with this type of defect. And again, we talked about the hearing issues, right? So the ear, nose, and throat doctor is going to follow along with them, as well as the hearing specialist. And sometimes what happens is they can actually put in special tubes inside the ear, which help to drain out fluid, which decreases the number of infections and therefore the risk of scarring and the risk of hearing loss. And then again, your dentist is going to be following your baby very closely, as well as oral surgeons to sort of help with that as well. And then it's important to remember that while you're going to have these initial surgeries right at 3 to 6 months or at 12 to 18 months, as your baby continues to grow, the structure right of their face is going to change as well. So they're going to continue to need surgeries a little bit later on in life as well. But despite the fact that your baby may have these defects and require these surgeries and may have to be followed by all of these specialists, the majority of these kids actually can have a normal appearance later in life with normal speech and normal hearing. So that is important to remember. Right now, we really don't say that there's a direct connection. There's no link to saying that babies who have a cleft lip and palate have their intelligence affected. So they should be able to learn and operate in school just as well as their peers. Some studies have shown that babies who have just a cleft palate are more at risk to have sort of learning disabilities, but the current recommendations are that they go into regular classes with everybody else. Teachers shouldn't treat them any differently. And then if they start to show signs that they're having trouble, then you kind of start the process of having your baby or child evaluated at that time. So the good news is that most of these babies do just well and do just fine. And the great news is that there's lots of support. So if you go and Google the Cleft Lip and Palate Foundation, there's lots of support groups, there's lots of information for parents and families, as well as for kids as they get older, teenagers, and even into adulthood, so that they have a community to get support as they're sort of dealing with this issue. So I hope that you learned something from this information. I wanted to highlight it again because July is National Cleft and Craniofacial Awareness Month. So I hope that you learned something. Please also share this with your family and friends. Please follow me all across social media as @Dr. Lanice MD. That's the @ DrLaunicemD to learn more about me. Please check out my website at www.drlanicemd.com. To stay in touch with me, sign up on my Facebook page. You can also sign up on my website. And when you do this, you'll be sure to get my free audiobook. So see you next time. Don't forget to find me next Wednesday, 7 p.m. Eastern Standard Time, right here on Facebook Live. Thanks so much for joining. Have a good evening.